All right, you know, getting braces is never fun, but imagine getting your teeth straight in only half the time. That apparently is now possible thanks to a breakthrough procedure called SureSmile. Here with more information is orthodontist Dr. Todd Hardin. Dr. Hardin, good to have you with us.
Thank
Appreciate
you.
it.
Thanks for having me on.
Tell us about how this works. SureSmile is a new technique?
Yes. When we put braces on the teeth, we get them straight pretty quick, but then we have a trouble getting the teeth to fit together, and historically in orthodontics that takes a long time. We're using computer-aided design now to move all the teeth simultaneously to a perfect fit in a very short time, and so we're realizing treatment times half of what we used to be able to do.
How is it? Is it any different than before? I mean, I had the bands put on and I had the wires between and they adjusted every month and it hurt. I mean, is it the same process?
It's a little different. We still put braces on the teeth and we still use wires, but the adjustments you're talking about we've pretty much done away with by basically scanning the teeth into a computer and visualizing our final result, and then making a wire that has all the adjustments in it already put in your mouth, and all the teeth move to perfection in a very short time.
Amazing.
All right, to tell us what they went through, we've got Cindy Vanier and also Jamie Jacobson. Cindy, let me start with you. Why did you decide to get braces in the first place?
As I got older, my bottom teeth started moving out some, and one of them had moved out farther and was just catching on my top teeth. And it just started to really bother me, so I talked to my dentist about it. And I was telling Dr. Hardin earlier that I hadn't realized how bad my teeth really were until I came in.
Oh, really? And so how long did he say it was going to be for you?
We were looking at about 2 years.
And so you decided then?
I went ahead and did it, and about halfway through, we switched to the SureSmile.
And we were able to shave 5, 6 months off our treatment
that's
time.
great. Yes. And the before and after are really incredible. Did you experience any pain with that?
There was a little bit of pain at first, but the SureSmile wasn't any problem.
And the pain comes from what?
The pain, a lot of it's just the inside of your lips getting used to the brackets and everything and rubbing against them.
Yeah, Jamie knows all about that because kids with braces are playing PE, they get hit and they get little cuts and things like that. Jamie, how long did yours take with this system?
With the SureSmile, it went really, really quick. I wasn't in it for more than a few months.
Now, wait a minute, that's not fair. Mine took two and a half years. way back
and
when.
Did you explain to folks the headgear too that you had to wear to school?
Can we leave that memory back out?
I'm sorry.
Well, we do have great pictures of Jamie before and after.
Yes.
Jamie, this was a remarkable transformation. Just look at that.
Look at that.
That was horrible.
Yeah. Well, you just got to be incredibly happy with how that worked out, huh?
Yeah, definitely.
When we talk about cost, what's the difference?
They're real similar in cost. There's a lab fee associated with making these wires that we pass along to the patient, but it is not very much different than traditional braces. So not a big significant change.
And I know that with myself and with my kids that had the braces, it was once a month. Are the appointments, as a lineup for your times you have to see the orthodontist any different?
We're seeing the patients more like a 6 to 8 week cycle instead of a once a month type cycle, so they're less of an effect on their quality of life.
Who best fits this? I mean, is there a patient that it won't work for and a patient that it really will work really well for?
It's designed for people with all their permanent teeth in place, adults or late teens. Kids that are still in their baby teeth are not good candidates for it because we're not really able to move those teeth very well. It's important to note with Cindy's treatment too, she had a great example of an adult treatment where we were able to straighten those teeth, and then she had some bonding done on some of the front teeth by her dentist out in Troutville, Dr. Adams, that did a phenomenal job just getting us a final result.
And I know that with traditional braces, the kids wear a retainer with a wire that kind of keep things straightened out for the next few years or so to make sure it keeps. Is that the same case here?
Orthodontists, as a general rule, are into permanent retention now. We know that teeth have a tendency to move whether you got them straightened out or not, and so we believe in bonded retainers. Both of my patients here have bonded retainers hidden behind their teeth, and it keeps those teeth straight indefinitely.
Well, what's the difference then between, I've seen something like Invisalign where it's an invisible thing that you put on your teeth. Does that work the same way, or how does that compare?
Invisalign is a great product for a smaller, at least in our hands, a smaller segment of the population. It has limitations in what it can do. We found that more complex treatments were not able to get a good result with that product, and so we tend to limit it to very mild things.
Okay. So if folks want to find out more, they should talk to their dentist about it, and it's called Sure Smile is the process, right?
Absolutely.
But if you want to talk to Dr. Hardin, please give him a call, 503-666-2196. And you two both look great. It's awesome. Congratulations.
Thanks for sharing those great smiles.
They're great patients.
So,